our medical expert, Dr. Cedrek McFadden. He's here to talk about health disparities in COVID-19. So let's talk about what health disparities are.
Yeah, so we're talking about today these differences or these disproportionate differences in health outcomes based on ethnicity and race. This is not anything that's new, but what COVID's done, it's turned the light on these differences. We've known for years that blacks have higher rates of diabetes, high blood pressure, lung disease. We've seen the poor outcomes with breast cancer and lung cancer. We've also seen the higher rates of maternal morbidity in these patients. But this is actually being exposed even more with COVID-19.
And what has COVID done? I mean, what has it really exposed to us?
So we see that blacks have higher rates of infection and death, and this is seen around the country, even in South Carolina. The population in South Carolina is 27% black, but blacks account for 57% of COVID-19 deaths and confirmed cases, 36% of confirmed cases in South Carolina.
And what are the reasons? Like, why do the disparities exist? We've seen some reporting on this, but let's go over it for people.
So it's easy to think it's the comorbidities. It's easy to think it's the heart disease, it's the diabetes, it's the lung disease, but it's more than that. You know, this is a complex equation of other factors. We refer to them as social determinants of health. It refers to, you know, do you have a grocery store in your neighborhood? Do you have access to a doctor in your neighborhood? And if you have to ride the bus to your doctor, is there a bus stop at the doctor's office? Do you have a park in your neighborhood that you can exercise? And we've talked about social distancing with COVID, but do you have a frontline job that doesn't allow you that opportunity to work from home? You know, if you are an essential worker working in the food service or the healthcare industry, you don't have that option. So, you know, these higher densely populated areas, all that goes into play with why these outcomes are even more so exposed right now.
So when people look at the big picture here and the health disparity problem is complex, what are the solutions that are recommended at this point?
The first thing we have to do two things. We have to first acknowledge the problem,
right,
and then we have to address the problem. And addressing the problem has sort of short-term and longer-term issues that we have to face. In the short term, we have to make sure we have adequate, accessible testing available. We have to make sure we have medical care provided for these patients. But in the longer term, this is a commitment. This is a commitment of changing some of the systemic issues that we face. You know, making sure we have adequate grocery stores, making sure we have doctor's offices, make sure we have, you know, jobs that allow people to take off from work when they're ill. I mean, these are the things that are going to take a longer term time to fix as opposed to just a right now fix.
Do you think it's important that we had the light turned on in this moment so that people can pay more attention to this?
It is very important because at some point the panic and the pandemic of COVID will go away. But unless we're willing to face these problems now, you know, we'll still see these health disparities even after COVID's not an issue anymore.
And this has been one of your passion areas, right?
Absolutely, absolutely, because we see it every day. I mean, it's my family, it's people I go to church with, it's people that we see every day, that there are differences. And we have to, you know, peel back the layers to see why these differences are there so we can find solutions that work.
So you need all of us to get a little passionate about this.
This is not just, you know, one problem. This is all of our problems.
Got it.
Yes.
Dr. Cedrek McFadden will be back live at 5. Thank you for this.
Yes.
But we will be taking your questions about the health situation surrounding COVID-19. You can go to the 7 News Facebook page right now and add your questions to the list. Thanks, Doc.
Thank you.
And coming up, the stories that Carolina's family's clicking on today are top trending news stories on WSPA.com.